Western medicine provides excellent medications to lower blood pressure, but today we will explore holistic measures beyond pills. Before we dive deeper, please pause this video here briefly to read this disclaimer. High blood pressure or hypertension is often called a silent killer. This is because it typically develops slowly without producing any obvious symptoms, all while quietly placing continuous stress on your heart, blood vessels, kidneys, and brain. Left unmanaged over time, this strain significantly increases the risk of heart attacks, strokes, and kidney disease. For most adults, a healthy blood pressure reading is around 120 over 80 millimeters of mercury. Most medical societies generally advise initiating prescription medications when blood pressure consistently exceeds 140 over 90. However, individual target numbers vary based on your age, overall health, and underlying medical history. This is why personal evaluation by a qualified healthcare professional is essential. Furthermore, elevated blood pressure can sometimes be driven by secondary medical conditions, such as an overactive thyroid, or by certain prescription medications and over-the-counter stimulants. Identifying these root causes is a crucial first step. When we look at landmark Western clinical guidelines, such as the JNC reports, they offer a great summary of conventional pharmaceuticals. But what is often overlooked is that they also provide an exceptional framework showing just how powerful daily diet and lifestyle modifications can be for lowering blood pressure. Weight reduction. Achieving and maintaining a healthy body weight for your frame can yield a dramatic drop of 5 to 20 millimeters of mercury for every 20 pounds lost. Dietary approaches and the DASH diet. Adopting a dietary pattern rich in fruits, vegetables, whole grains, and low-fat dairy, commonly known as the DASH diet, can further reduce systolic readings by 8 to 14 millimeters. Dietary sodium reduction. Decreasing your daily sodium intake to less than 2.4 grams, about 1 teaspoon of table salt, can lower blood pressure by an additional 2 to 8 millimeters. Regular physical activity. Engaging in moderate aerobic exercise for just 30 minutes a day on most days of the week can lower readings by 4 to 9 millimeters. Alcohol moderation and tobacco cessation. Limiting alcohol intake can lower readings by 2 to 4 millimeters. Furthermore, while smoking cessation may not directly alter long-term baseline numbers, every cigarette causes an acute blood pressure spike, making quitting essential for reducing overall cardiovascular risk. When added together, these non-pharmacological interventions can make a profound clinical difference. For many individuals with mild hypertension, sticking to these habits can mean the difference between needing prescription medication or managing blood pressure through lifestyle alone, or reducing a complex regimen from 2 medications down to just 1. Beyond basic lifestyle habits, several natural dietary supplements are frequently discussed for supporting healthy circulation. The most commonly studied include magnesium, coenzyme Q10, ground flaxseed, and aged garlic extract. Safety precautions. Supplements must always be used under the supervision of a qualified healthcare provider with your blood pressure closely monitored. If a supplement fails to support a safe reduction in your readings, it should be discontinued. While high blood pressure gets most of the attention, excessively low blood pressure is equally dangerous, particularly in older adults, where it can cause lightheadedness, dizziness, and dangerous falls. Additionally, supplements are not one size fits all. For instance, magnesium should generally be avoided or used with extreme caution in patients with underlying kidney issues, because the body may struggle to clear excess amounts. The specific form of magnesium matters too. Forms like magnesium citrate or magnesium oxide are often chosen if you also experience constipation, whereas forms like magnesium glycinate are preferred for general support without a laxative effect. What you drink throughout the day also plays a direct role in vascular tone. Caffeine found in coffee, traditional teas, and energy drinks can temporarily spike blood pressure by constricting blood vessels. Limiting stimulant intake or switching to decaffeinated options is a simple, effective swap. On the positive side, certain plant-based options naturally support open, relaxed blood vessels. For example, consuming brewed hibiscus tea daily has been shown to support healthy systolic pressure. Beetroot juice. Beets are naturally rich in dietary nitrates, which can lower blood pressure. Turning to Asian traditional medicine, acupuncture is recognized in official World Health Organization reports as a clinical modality that shows promise in supporting blood pressure management. By modulating autonomic nervous system activity, targeted acupuncture points can help ease vascular resistance. Similarly, Qigong and Tai Chi, traditional practices that combine gentle physical movement, mental focus, and regulated breathing, have a growing body of clinical evidence supporting their ability to promote cardiovascular wellness. In Ayurveda, India's traditional system of healing, high blood pressure is understood primarily as an imbalance in the Vata dosha, the principle governing movement and nervous system activity. However, it can also stem from underlying imbalances in Pitta or Kapha, because Ayurveda is a deeply individualized system of medicine. Getting evaluated by a trained Ayurvedic practitioner, Ayurveda utilizes several time-tested botanicals to support cardiovascular health, such as Arjuna tree bark and hawthorn berry. However, rather than taking these herbs indiscriminately, an Ayurvedic physician helps identify precisely which botanical is appropriate for your specific. Ayurveda also heavily emphasizes combining these herbal strategies with regular meditation, gentle yoga, and structured breathwork, pranayama, to calm the mind and ease pressure on the vascular system. This exact principle of slow diaphragmatic breathing found in pranayama is used by RESPeRATE, an FDA-cleared non-pharmacological device designed to guide your breathing down to therapeutic rates to lower blood pressure. To explore how these traditional principles apply to cardiovascular care in greater detail, I highly recommend reading the Hypertension chapter in the complete book of Ayurvedic home remedies by Dr. Vasant Lad. Managing high blood pressure safely and effectively is not about relying on a single pill or a single habit. It's about building a compassionate, well-rounded blueprint that integrates Western medical oversight with daily lifestyle habits, smart nutrition, and time-tested mind-body modalities of the East. Thank you for watching. If you want to learn more about integrative medicine topics, please click on this next video right here. I'm Dr. Sharma, wishing you physical, mental, and spiritual balance. May all beings be happy. May all beings be healthy.